In the heart of Missouri, the work of one man's life became a gift of hope for thousands. That man was Dr. Franklin L. Mitchell, Jr., MD, physician, teacher, pioneer, and mentor. Born in 1930, Frank grew up in Excelsior Springs, Missouri. In 1948, he moved to Boone County to attend the University of Missouri, a move that would define not only his future, but the future of trauma care in Missouri and beyond. It was in Columbia that Frank met the love of his life, Stevens College student Lynn Miller. They married in 1953, beginning a partnership that would last a lifetime, one marked by devotion not only to each other, but to the University of Missouri. Together, Frank and Lynn gave of themselves generously, including a multi-million-dollar commitment to the hospital and trauma care center, a testament to their belief in serving the people of this state. Frank graduated from MU in 1951 with a degree in biological sciences and honored by membership in Phi Beta Kappa and Phi Delta Theta. From there, he earned his Bachelor of Science in Medicine at the MU School of Medicine in 1953, and then his medical degree from the prestigious Johns Hopkins School of Medicine in 1955. In 1957, his career path would be recast when he was drafted into the United States Army. As Captain Mitchell, he served 2 years in Germany, treating soldiers injured in auto crashes and tank accidents. There, he saw firsthand the life-saving potential of helicopter evacuation, an idea he would later pioneer in Missouri. Returning home, Dr. Mitchell joined the University of Missouri Hospital in 1959. What followed was a career that spanned more than 4 decades of service. He rose from resident to professor, then department chair, then program director, leaving his fingerprints on nearly every aspect of MU healthcare. Among his many roles, chair of university physicians for a record 22 years, director of trauma services and the state's first Level 1 trauma center, and founder of MU's helicopter medical transport program. But beyond the titles was a vision that changed the very way we think about trauma care. In the 1960s, when ambulance service was provided by funeral homes, something the doctor thought was at minimum a conflict of interest, he imagined something better. He secured grants and with MU engineers, assisted in designing one of the nation's first modern ambulances. The late Dr. Marjorie Dale, the emergency services director between 1961 and 1965, was also a key architect in designing those first ambulances serving the University Hospital. Dr. Mitchell is also credited with insisting on training paramedics to bring advanced care to the field. In 1974, he launched Missouri's first paramedic training program. In 1980, Dr. Mitchell launched the first helicopter service at University Hospital in collaboration with the Missouri State Highway Patrol. By 1982, he introduced the University Hospital's first permanent helicopter service, the Staff for Life service, ensuring that patients reached care within the golden hour, the difference between life and death. Through his work, Dr. Mitchell saved not just hundreds, but thousands of lives. His research revealed that nearly 40% of trauma deaths might have been preventable with faster intervention. And then he built the system to change that reality, studied and replicated across the United States.
Occasionally over the years, the University of Missouri would take their helicopter and take it down to the Lake of the Ozarks. And a woman came up to the front of the helicopter and patted the helicopter on the front nose and said, "This helicopter saved my son by transporting him to the University of Missouri." And that's, to me, summarizes a lot of that work, because they were trained people on that helicopter, and that helicopter transported that patient to a place that could handle whatever his injuries happened to be. And that was from all the work that had been done over the years.
Colleagues and students alike describe him as a visionary, but also modest and tireless. From 1987 to 1996, as chair of the American College of Surgeons Trauma Verification Review Committee, he led a national campaign to standardize trauma care, setting rigorous standards still in place today.
There was a group of about 5 individuals nationally who saw the value in standardizing care and quality in trauma centers across the United States. I believe it was 1983, Dr. Mitchell became the chair of a committee to explore verifying trauma centers. One only needs to look at how we publicize MU Healthcare. One of the publicity lines for healthcare is that we are the only verified level 1 trauma center in central Missouri. That verification process, which now happens at hundreds of hospitals across North America, was started by Dr. Mitchell and now has expanded globally to where verification is taking place outside of the United States. So he was really the foundation nationally for how we set standards, hold one another to those high standards in order to be deemed a verified trauma center in the United States. That was all started by Frank Mitchell.
Over the years, there were many honors, including MU's Faculty Alumni Award, the university's Distinguished Faculty Award, the American College of Surgeons Outstanding Service Award, and in 1995, the Elite Scudder Orator Award, among the highest recognitions in surgery. In 2009, MU Healthcare honored his extraordinary contributions by naming the university's Level 1 Trauma program the Frank L. Mitchell Jr. MD Trauma Center. It remains one of only 5 Level 1 centers in Missouri, verified by the American College of Surgeons. To this day, his name stands above the doors of an institution of healing where lives are saved daily, the clearest symbol of a legacy that endures.
When they did that, they kept it a secret from him, which was not an easy thing to do. I mean, he prided himself on having more information than other people. And so they had a big celebration planned, and they had a dinner for him out at Old Hawthorne. And a bunch of his colleagues came to town for it, trauma surgeons from all over the country. There must have been 15 or 20 of them. And it struck me that night that these were the godfathers of trauma. These were the people that invented trauma care and advanced it and pushed it along and fought through it. And so Frank he would not have approved if he'd have known in advance that they were going to do that. He was a lot more humble than that and didn't spend a lot of time drawing attention to his actions. But it was an interesting time to see all those trauma folks in one place and all of them lauding what was going on with him and here and the pride. And these are people like Don Trunke and Erwin Thal and people from all over the country. It was special to him, and I know that he shared a lot of pride with it. I think I was asked to speak that night at the dinner, and one of my comments was that what was going on in the room and the capacity and knowing the history of how these handful of surgeons forced the American College of Surgeons to identify trauma care. And they created the Committee on Trauma, and a focus was specifically put on that. And so, yeah, he had a lot to be proud of then.
Dr. Mitchell was more than just a physician. He was a builder of programs, of systems, of people. He mentored generations of doctors, nurses, and paramedics. He inspired colleagues with visionary ideas tested on the trauma floor that would one day become national policy. And he did it all with humility, humor, and a quiet determination that made him beloved. Frank L. Mitchell Jr. gave nearly 50 years of his life to making his vision real. Husband, father, teacher, mentor, and pioneer, his legacy is written in the lives he touched, the lives he saved, and the hope he gave. Ladies and gentlemen, and esteemed guests, please welcome into the Boone County Hall of Fame, Dr. Frank L. Mitchell Jr.